the um, April meeting of the Douglas County Board of Health. For the record, there's a copy of the Open Meetings Act on the north wall of the legislative chambers. And with that, I do have official notice of the public meeting. With that, roll call.
Festerson. Rogers.
Here.
Weiss.
Yes.
Jones.
Here.
Okay, Wilkin is not here. King is not here. Espinoza, are you online?
She's online. She doesn't count, though.
Okay,
Yes, online.
okay. Thank you.
And Sandy, for the record, Laura Cerny is here in person. Glad for her to be back.
And Lauren Zenzik, yes.
And Lauren, you know everybody here,
Yes, mostly.
right? Okay. And then note, Deputy Chief Scott Gray is on, and I think that's all I see.
Okay,
With that, item 2 is approval of the minutes for the March meeting. Is there a motion and a second?
Second?
Motion by Wade, second by Weiss. Roll call.
okay, Wade? Yes. Rogers?
Yes.
Jones? Yes. Weiss?
Yes.
Item 3 is public comments, opportunity for individuals online or in the chambers to comment on Board of Health related items not listed on the agenda. Are there any public comments at this time? Seeing none, we'll go to the action items, items A through D. Is there a motion to approve the action items?
So moved.
Motion by Weiss, is there a second?
Second.
Second by Wade. Any questions, concerns? Hearing none, roll call.
Festerson? Yes. Rogers?
Yes.
Jones? Yes. Weiss?
Yes.
And Wade?
Yes.
Item 5 is the Health Director reports and issues of discussion. Dr. Hughes. Morning.
Is your mic on? It's not recording and I don't see it on this one. See on the, audio level, oh, I forgot, lectern microphone. That must be the,
Yep. Oh, no, that would be that one, right?
is it on now? Okay. Yep, thanks.
All right, take 2. Good morning. A few updates that I have for you today. First of all, I wanted to start out with a couple of recognitions for employees who have been with us for a time. Both of our recognitions this morning are for employees in our WIC program. We are recognizing Laura Marshbanks for 25 years of service and Tracy Fisher for 20 years of service. And I believe that Laura and Cassandra, her supervisor, are online, and then Leah Casaneva is here in the room. Cassandra or Leah, do you have any words you'd like to share for Laura and Tracy? Cassandra, go ahead.
The screens went off.
If you're talking, we're not able to hear you.
Okay, it sounds like everyone else can hear me.
We can hear you now, Cassandra.
Oh, okay. So, yeah, Laura Barshmanks is our vendor manager, and she is wonderful. She works closely with our vendors as well as the clinic staff and our families, and she does such a great job. She is just super easy to work with and really great about getting issues resolved. And I can't say enough good things about her. She's such a hard worker and gets along great with everybody, and has had a really good this year. She also has been a big part of the success of our breastfeeding programs over the years. So I really appreciate Laura and thank her for her years of service. And then Tracy is one of our WIC dietitians at our West Omaha clinic. And she worked at the Midtown clinic as well for several years, and then moved over to the 120th clinic when we had an opening. And she's also amazing and works really well with her coworkers and the WIC families and participants, and is just such a wonderful asset to the WIC program. And so again, I thank her for her years of service and congratulations.
Thank you, Cassandra. And I just want to echo how grateful we are for both of them. Vendor management is really no joke. To really have someone who is focusing on setting up all of the grocery stores and retail locations so that they're able to take WIC is quite an undertaking. And so we're very grateful for Laura and her expertise in doing that. And of course, our dietitians make a huge difference in our community. Really, everybody in WIC does. It's a really incredible program that gives kiddos the very best start they can possibly get. So thank you, Laura and Tracy, for everything that you do for us. And we're just very grateful to have you on our team. Okay, so I have, as I said, a number of updates, and I'm going to start off just very quickly updating you on the dashboard, which we've talked about several times over the past few months. I wanted to let you know that as of this morning, the new updated dashboard is live. And so I wanted to go ahead and show that to you here real quick and give you I wanted to make sure you knew where to find it. So you can actually access this the exact same way that you would if you were...
Dr. Hughes, if anybody's on Zoom, can I ask you to mute your mics, please? Thank you.
So you can actually get to this the exact same way that you would would have gotten to it through the COVID dashboard, so through our page. There's a Jay Jensen on Zoom. If you could just mute your mic, that would be wonderful. Thank you so much. So you can get to it that way. And if you prefer to try to dial in directly to it, it's DouglasCountyHealthPortal.com. So very easy to remember. And you'll see that it looks a little bit different when you come to this page than what it did before. Before, it took you straight to the COVID-19 dashboard, but we have expanded this and kind of broken up the information in different ways to make it just a little bit more intuitive and searchable for people. So COVID-19, certainly you can still get there. You've got vaccination data, hospitalization data, and then, as we've discussed, we've added influenza data and RSV data. So this is really kind of a nice respiratory dashboard, if you will. I had Justin Frederick up here last month to show you basically what this dashboard looks like, so I'm not going to belabor it too much. But essentially, you can click into whatever it is that you want to see from that main menu, and it's going to take you into, so I've clicked on the dashboard for COVID-19, so it's going to take you, and I'm on a tablet, so it's not quite what you would look at if you were on a desktop. Let's see if that fixes that a little bit. There we go. So this is, if you remember last month when Justin showed you this is essentially what you're going to see. and you can scroll through and it's going to have all different kinds of data. I do want to just note for you that we do have a couple tweaks here and there that we're still working on, but we wanted to make sure that we got this live and up and running since we've been promising that for some time, and we want to make sure it's up for people to be able to use. So it is fully live this morning. So please feel free when you have time to go out and explore this and see what you think. And we are always open to feedback. All right. I also wanted to give you an update on the infrastructure grant that we received and are working on. Currently, we are working on our head count, which I believe is due tomorrow. So Jerry McKay, our budget manager, is very busy and not here today, so she can finish working on those items. But we have a number of positions that will be created under that infrastructure grant, and we have position descriptions that are currently with HR under review. So as soon as we have approval on those, we'll be able to start hiring into this. And just to kind of refresh your memory about what kinds of positions we're looking at, we are looking at workforce development. We're looking at data modernization, some other data people essentially to help us do a better job of ensuring that up-to-date information is always out in the community for people to utilize. And we also have a number of communications positions that will help us to do a better job of hopefully communicating through a variety of avenues. And so those are kind of the big ones that we're expecting under that infrastructure grant. And like I said, as soon as we have approval on those, we'll move forward. Another update I wanted to give you was on space for Douglas County Health Department. As you know, we are very tight on space. And due to the infrastructure grant, we were able to secure several more offices within our building that previously belonged to General Assistance, and we want to just express our gratitude to General Assistance for working with us on that. We are currently undergoing some renovations in that space to make it most usable for us, and also assisting General Assistance to do a little bit of renovation in their own space so that they have better storage capacity over there. So we will hopefully be moving people into those spaces in the next few months. On accreditation, I wanted to update you that our accreditation coordinator did leave us for employment elsewhere, and we're really lucky she set us up well to continue to proceed forward even in her absence. So we continue to gather all of the documentation necessary, and we're still on track to meet our goals in terms of accreditation. So we're really glad for that, and we'll continue to update you, but at this time, we are where we should be with that. I also wanted to let you know, you probably went into the Board of Health intranet site and looked at reports, and you may have noticed that the budget information was missing on all of those reports. And I told people that they could forego those reports this month because our budget office is knee-deep in doing our annual budget right now, and it's going to require a little bit of rewriting of some reports in order to get those numbers monthly for you. And so next month we will have those numbers on that report. This month we just really needed to prioritize making sure we get our budget in on time. Okay, another update for you on our strategic plan. So as you will recall, we did a strategic plan back in 2018. It was published for 2019. Then the pandemic hit, which derailed some of the goals in that strategic plan. We were due for a new strategic plan at the 5-year mark, which is now. So we are going to plan to archive that existing strategic plan and RFP out for a company to come in and assist us with developing our next strategic plan. Next month, however, when I come to you with the State of Public Health report, I will also be reporting out to you the successes and outcomes that we had from that existing strategic plan. So I won't leave you hanging with the information on that. And then I think the only other update that I have for you, I wanted to just recognize our management team at Douglas County Health Department. The whole health department has been through a lot of transition in the last few years. The management team has undergone probably more than their share with new leadership, not just in my position, but a number of new chiefs and new supervisors that have come on. So as you can imagine, there has been a lot of, just all of those steps that you have to go through to form a strong team. And it's been certainly a little bit chaotic at times. I did bring in an executive coach to help us to really bring that team together so that we can do an excellent job of leadership and moving forward. And I really am proud of how engaged and how excited really our supervisors and chiefs have been in engaging in that team building work and really learning to build trust and confidence and shared goals and vision. And I'm just so proud to have watched that growth and seen that happen. And I just wanted to recognize them for that excellent work. I have really good feelings about where our leadership is moving in the future. So everybody, you're doing a great job. Please keep it up. And that, I believe, is the end of my updates for you this morning, and I'm happy to answer any questions that you might have.
Dr. Hughes, first one is just, I think I'm reading it right from what you said. So when I look through the grant reports, I thought it was that, but it's just confirming like how you got it coded in yellow, which is good. So how much is the infrastructure grant again as a whole?
I believe it was close to $8 million for the
Okay.
total award. We get some upfront and then a continuing award after that,
Okay.
for up to 5 years.
So most of it is going to reside with Jamin and
Mhm.
Okay, that's fine.
Okay.
Other point, and I'm just saying this because I'm thinking this is a you, Justin, and Aaliyah piece, but I know LB 777 is on the agenda today. It likely goes, but I just like you all to be on notice, particularly for the epidemiologist, and because if it looks like it's on a likely track, I just want to be prepared to kind of keep track of what that impact will be. Because if it does, I think there's going to be a heightened public health prevention role just on the education. And if you all can just watch that, and if it is, be prepared to kind of ramp up with the statistical piece and how do we just communicate the effects of it if there is to some degree. So I just want to put that on you all's radar.
Absolutely.
Okay.
We will do that.
Anybody else? Alrighty.
Thank you.
Thank you, Dr. Hughes. With that, we'll go to item 6, which is presentations. And one is item A, is the Health Nutrition Division update. For the record, just for the board, from the conversations probably about 2 months ago, that the Board Administrative Committee has been meeting and will be regularly meeting monthly. A couple of things came out of that was the board's desire to just have a regular insert of in-depth or just a presentation of the different departments. So that piece is today. And as Dr. Hughes noted from the reports, that's a constant evolving piece. But I just wanted to put that there in regards to what the board wanted to do and some of the follow-ups on that. So with that, we'll go to Leah.
Awesome. Well, good morning, board. So my name is Leah Kazanave, and I'm the Division Chief of our Community Health Nutrition and Clinic Services. And I apologize, I feel like the agenda was kind of taken over by our division today. So here we go. So to kind of give you guys a brief overview of all the wonderful programs that are in this division, we have our STI Immunization Clinic, which has our STI services, adult and childhood immunizations, as well as COVID vaccines. We have our STI Prevention and Control Group that really does the surveillance of STI and outreach education and testing. We have our Women, Infant, and Children clinics. And they really include nutrition education, breastfeeding support, referrals, and healthy foods and formula. And then lastly, our health promotion program, which includes tobacco prevention, fetal infant mortality, baby blossoms, community health workers, and our overdose review program. So quite a bit. So to start, our immunization clinic. So I kind of just put up here some of our COVID vaccine data, and as you can see, some of the indicators we have. We did 314 clinics in 2022, and we administered 10,335 doses of COVID vaccine. With our home visit program that we had, we provided 346 doses in 2022. Now, I did a breakdown by race ethnicity on the side that I'll let you guys just read through, but then moving into just routine immunizations that we have, we did 636 and for children and 316 for adults. Now for our flu season, 259 children, 955 adults. And then lastly, we had Mpox in this last year, and we provided 1,526 doses of the Mpox vaccine. 61% of those were white non-Hispanic, 14% Hispanic, 5% Black non-Hispanic. Just to give you kind of a breakdown of what our immunization program breakdown sort of looked like. So, some accomplishments and challenges that happened we have with our immunization funding. Unfortunately, is in 2023, we're not going to be able to serve our underinsured adults through our Vaccines for Adults program. We can still do the uninsured, just not underinsured anymore. And now, great thing that happened in 2022, our clinic responded to the Mpox public health emergency by initiating a rapid vaccine program, screening and vaccinating eligible high-risk individuals, as well as supporting 4 other facilities in Douglas County to stand up their own vaccination programs. So kudos to them, because that was after 2-3 years of COVID. So they were a little burnt out at that point, and having this brought on, they handled it extremely well. Moving on to STI clinic. So in 2022, we had 2,991 clinic visits. At those visits, we had about a 15.6 positivity rate of the folks coming to our STI clinic. And this is a 55% increase in our average visits per month from 2021. So you're seeing our STI clinic is picking back up, which is great. The treatments administered in our STI clinic were 908. And then, sorry, I'm still getting over a cold. Then we've had about over 50% of our clinic patients are less than 30, which is sort of that age group we want to target anyways. As I said, you can see a breakdown of race ethnicity for our population versus the clinic. And I think what's great about our clinic percentage visits is we've got about 30% of them that are Black folks. We have 47% white and almost 18% Hispanic, which is higher than the DC population. Some accomplishments and challenges that we've had with our STI clinic. Start with the good stuff. So we resumed our hepatitis C testing, and we resumed our walk-in services. We had originally been just appointment only, but now we are opening back up for more folks. And one of the big things we've been working through is getting a electronic health record started. So we've been researching and figuring out what system we're going to begin, and hopefully in the upcoming month or 2, we will get that finalized and started. So we're very excited. We have been working with the HHS and the MPHL to start a gonorrhea culture testing project, which we started one prior to COVID, I believe. Small, and now we're just really going to be ramping that back up again. So excited. And lastly, one of the big challenges that we've had is a loss of funding in our STI clinic. And that's resulted in a reduction in hours, and we've had to reassign some staff to other areas in the health department due to loss of funding. So hopefully for 2023, we'll be able to find some additional funds so that we can keep up our STI services. In our prevention and control program, we've been able to secure a new epidemiologist. And once again, loss of funding in this area because our clinic and our outreach programs sort of go hand in hand, which has led to a reduction in some of our outreach activities. We've had some new testing locations at Women's Center for Advancement and the Latino Center of the Midlands. We started a at-home testing program. Currently, we've had almost 180 requests for our at-home testing. We've mailed out 76 kits and had 45 of those folks mail in their completed test kits and gotten them test results. So some of the performance indicators. In 2022, we had 403 total tests with about a 7% positivity rate. Delivered over 150,000 condoms throughout 2022. And for surveillance pieces, chlamydia, we've had one of the highest rates in the past 10 years. Our syphilis cases, we're at 79 cases, which is almost double what we had in 2020. Primary syphilis rates in women have increased 100% since 2021, and with 132% increase in our unknown latent, which is not the infectious stage. Now, congenital syphilis is the big one, and we're at 75 per 100,000 with our rates, which is an increase of 20% from 2021 and even a higher percentage from 2020. And I don't have that with me right now, sorry. So I just added this in here to kind of hit the case home that STI is becoming an issue. We've seen rates increase drastically, especially among syphilis, but we've also not receiving as many funds to address this problem. So just kind of mentioning some things in here about how syphilis and chlamydia have gone up drastically in the last year or two. Now on to our women, infant, and children clinics. So for the total Douglas and Sarpy County participants in 2022, we had over 23,000. In our Douglas County Midtown, we had about 5,425 participants. At 120th, we had 4,666. We've been doing the PHQ-4 questionnaire with our folks at our participants, and we've had 1,504 respondents. And I'm glad to say that most of our population has really been in that 0 to 2 normal range at about 89%. 6.2% of our respondents that were actually referred to mental health services due to this survey. So breastfeeding rates increased. Exclusive breastfeeding at 3 months went from 19% to 33%, and exclusive breastfeeding at 6 months went from 13 to 20. So some other accomplishments and challenges. We moved locations for our West Omaha, our 120th location, and we will be having an open house on May 12th from 2:30 to 4:30. We hope that you all can make it. And the address is 4203 South 120th. We're also searching for a new Midtown WIC location, and hopefully we'll have that in the next year or two. Our Douglas Sarpy WIC staff completed a new breastfeeding curriculum training. We reopened our clinics for in-person services. They were all virtual during the COVID pandemic. We're hoping, so one challenge that we're having is we really want to be able to hire and recruit new breastfeeding peer counselors within Douglas Sarpy County. And we're excited to say we have a new WIC breastfeeding program coordinator. Now for our health promotion program. This one is split into 2 slides because there's several different programs within health promotion. So we've got our Omaha Healthy Start program, and we're providing education. There was 8 and 9 sessions completed, and we had 30 participants that were educated on safe sleep and preventing prematurity. Our fetal infant mortality case review team, we've reviewed 7 cases, and they just started back up in January of 2023 after a 1.5-year hiatus, so we're excited to get that up and running again. And we also had our first Baby Blossom collaborative meeting, that was 2 weeks ago now, or a week ago. Okay, my days are all getting thrown together. And to that meeting, we had 28 folks in person and 32 virtual. And we were excited to bring Dr. Art James to present at that and partner with UNMC and Children's. So Omaha Healthy Start, another accomplishment is just some of the great connections we've made with our maternal child health partners throughout the community. And a challenge that we've had is really finding participants that are wanting to participate in these kind of safe sleep prematurity education courses. Like I said, we've relaunched our Baby Blossom and Femur case review team, so we're excited to get those up and moving again. Now, our community health worker program, we've had 699 referrals from April to March, and very excited to get that up and running. And you'll hear more about this as we have the next presenter coming up. And she'll discuss some of our accomplishments and challenges and kind of the breakdown of each of our community health workers and the work they've been doing. For our clean indoor air complaints from January to March, there have been 2 businesses and 3 multi-unit housings that have had complaints filed against them at the health department. Smoke-free housing, we have verified 228 of the 716 is smoke-free. And our overdose fatality review program, we've sort of relaunched those meetings and starting to get data kind of gathered, what that might look like as, fingers crossed, LB 570 starts moving forward, and we'll be able to obtain data on a more regular basis. And as I mentioned with LB 570, we're excited that it actually passed unanimously in the Health and Human Services Committee. The other kind of challenge that we're looking for is having funding for our overdose prevention program, and we're actually working on a grant application now. With our Tobacco-Free Nebraska, one of the accomplishments that we've had is the rent smoke-free list has been organized and updated. And a challenge really with that has been that that's a voluntary program, and it's really the responsibility of enforcing and burden really of the residents to report that out. So with our division as a whole, we've kind of had some goals that we want to accomplish. As I mentioned, funding is always a source that we need to kind of work on. Some of the programs that we want to make sure that we can contain and sustain is our mental health, and that will be hopefully determining. We've applied for some local grants and really working with some other funding that we've received to start up a pilot program with one of our community health workers. Funding for our STI outreach and clinic, and our overdose prevention, as I mentioned, we're applying to some national CDC grants for this. And also working with the food insecurity assessment, the nutrition environment measure survey. We are partnering with Sarpy-Cass Health Department to really come together and do a region-wide NEMS study and get that up and going again after the pandemic. With our infant health work, we're looking at a way to kind of bridge all of these programs together to improve infant health in Douglas County. That includes infant mortality rates, congenital syphilis, our nutrition, so breastfeeding, infant nutrition, and then hoping to kind of find some common goal between all of our divisions to really move forward towards improving infant health in Douglas County. And lastly, one of the goals that I have is that at least one person in each of our program areas has been trained in health literacy and is kind of the point person for any materials going out of our division so that things are appropriate for our community members.
I'm just curious is that the health is this the position, it was meetings ago, but is that the position, this health literacy deal? I thought I might have heard it as a health educator, like a general person that the community health workers work with to prepare materials to give out. Is that person?
Kind of. So there is, I want to say through NALED had came out and actually paid for some different folks from the health department could apply and become health literacy certificate specialists or health literacy specialists, a certificate in it. And it could really be any position. So I have like a HIV prevention specialist that's taking that certification so that anything in our STI office can go through her and one of our disease investigators so that they know the sort of language to use when talking with community members. We have a few folks in our health promotion program that are going through the certificate program now, and it's more or less just a benefit. So primarily it is educators that are doing it, but we've had, I believe there's a community health worker signed up right now. Oh, there are 3 signed up for it right now. So does that sort of explain?
I just had to stop it there because this is just for me because I want to be clear on that.
Yeah.
That, I thought it was, when I first heard it, and I was going to be clear, I thought it was like one person that all the stuff went to and vetted. But you're saying anybody in the department can get trained to be one of those persons. And when you're trained to be that person, that's like the health proofreader.
Yes. That's just a double check, if you will,
Okay.
for when stuff is created, that we're assuring that the information that comes out of those programs is literate for our community.
So that person is not the place where you go to, let's say how I thought I understood it, community health workers out there working, you all need to educate the public on something. Anybody could create some material that's consistent with the layout and other things like that. But whatever material is created is vetted through one of those persons for.
That is my intention, yes.
Okay, all right, okay.
Good question.
I did have a couple questions.
Yeah.
Early in the presentation, you were talking about the PHQ questionnaire.
Yes.
I don't know what that is.
So it is a survey that really goes through and assesses someone's mental health status,
Okay.
basically. And I don't have the questions, but it's 4 questions that go through and folks can answer those.
Okay. And then who is that given out to?
That is to the WIC participants.
Yep,
So
okay.
folks coming into WIC sort of take that survey as they're coming in their assessment. And then if they have a higher scale number on there, then we refer them on to mental health services.
Okay. And then I don't know if this is your department or maybe if this is a Dr. Hughes question or maybe it might have been out there and I missed it, but so that Narcan nasal spray,
Mhm.
opioid reversal.
Yeah.
So I'd caught that had been approved over the counter. Do you know anything on a timeline, or is the health department going to provide anything like that, or the government subsidizing anything?
So there
with that?
are Douglas County, like the health department, we are not able to dispense. So I'm not able to hand out that from us. However, we are in the process of writing a standing order policy for our clinic staff so that they have it on hand, so that if someone is in the department and experiencing an overdose, we're able to confront that and help that person. So that's one piece we are working on right now. I know DHHS with the Division of Behavioral Health, I believe, is actually working with pharmacies around Douglas County and having that available and paying for those, but there's some paperwork that I believe goes along with it. The website is Stop OD Nebraska is the website for that, and you can get on and see which pharmacies have that in place. That the state has actually provided that.
Okay.
Thanks for the presentation and the
Yeah.
updates. It's really helpful. A few questions. So, how are the community health worker referrals made?
Patty's presenting right after
Okay.
this, so she's gonna go into the whole community health worker program, so I didn't wanna give too much since it'd be just a repeat.
Perfect. And then for Hep C, I assume you guys are not offering treatment for that. So, how are referrals getting made for those folks?
That's a great question. I'd have to double check and make sure I get all the information for you. But I know that we have, I just am not sure who we refer to. But I know we have a referral system in place. I just don't know the details of it.
Okay. And what STIs are screened for in the at-home tests?
In the at-home test, we have chlamydia, gonorrhea, and it's for 3 sites, so our throat, rectal, and genital. And we also provide a at-home HIV test kit. And the way that we've been providing that at-home test kit is we have an educator that will call the person ahead of time and find out what sort of sex they're having. If you're having anal sex, we will provide a rectal swab to you. If you're only having oral sex, that's the only one we'll provide to you, just to make sure that you're getting the appropriate things that you may need. So after the test kit is sent out, she'll call back about a week or so later just to follow up, see how the test went, did you get it mailed out, and then also follow up with their at-home HIV test kit.
And how can you sign up for those?
We have a website,
Okay.
and I would say just visit Douglas County Health, and then there should be a link on that main page.
And last question.
Yeah.
For the smoke-free housing list, like where is that held, or is that accessible to the public?
It is, and I have the website in my email, but I want to say smokefreehousing.com, but I could be wrong. Is that right? I know Emily's on, so I can see if she can send it in the chat. Oh, they can't see the PowerPoint. I forgot to share the slides. I'm sorry to the online folks. Rentsmokefree.com. Yeah.
Go ahead.
I wanted to follow up on the STI part of the presentation. I mean, I know this has been a long-term challenge for our community, but despite all that we're doing about it and all that you're working on, the numbers you discussed are certainly on the rise. I'm interested in your comments on what you're seeing or what those challenges are that aren't getting the issue addressed sufficiently.
So I've seen some information from our STI team with our new epidemiologist. She has actually provided some graphs that will be at next month's Board of Health and can really show we had a decrease beginning to happen, or at least plateau prior to 2020. You could see from 2019 to 2020, we had some numbers start to level out. But then when the COVID-19 pandemic happened, things came to a screeching halt. And so now I think getting services back up and running is going to be our biggest hurdle. And right now, funding is lacking in that area, which is really creating our problem. So I don't know if it's folks not getting into their regular provider like they used to, or it's even maybe we weren't available like we used to be just because of our outreach testing program. Prior to COVID, our team was great about being out in the community and having testing available, condoms available, pretty much anywhere you could imagine. And we're slowly getting back into that, and a lot of bars and businesses have closed since we started, and really working to try and find new avenues, new places that will allow us in, but a lot of places aren't fully open yet. I mean, a lot of stuff has changed since 2019, so I can't say there's one specific avenue, but I know things were looking good, and then COVID hit, and I think it's with a lot of things that we've seen COVID impact.
Can you send the condoms with the kits, maybe?
They do provide those. Yeah.
And I guess there's a number of questions in the chat.
Yeah, I got them to read out. Okay, I'm gonna go, let me, one of the questions in there, let's start. There's a question from Dr. King. Have we considered a health literacy assessment? Or have we considered doing that?
We definitely can. I think that's a great point. And I'm sure our health promotion program may have done something along that a while back, but I think it's definitely, as we come out of COVID, something that we can consider and move forward with.
Okay. From your breastfeeding numbers, do we have those broken down by race?
I'm sure we do. I'd have to look at it, but I'm sure we do.
And so once you get it, that can be provided, or?
Yeah.
Okay. Are there next steps or plans for a Baby Blossom Town Hall?
We are planning on doing Baby Blossom Town Hall, I believe, quarterly. So the next one will be in 3 months.
Okay. Okay, I'm gonna bleed into some questions that I had. This is kind of both. So the funding sources, who is what are the sources that the reduced revenue are coming from? Is that grants, or is that private support that's reduced for the STD reduction?
There have been some state funds that got moved from yearly to 17 months, so we're having to stretch the same amount, but over a longer period of time. We've had some private funding that
State general fund or flow through money to the
flow through from CDC.
Okay.
And we've had some private funds that got cut. I want to say those are the two big ones that have kind of happened recently.
Okay. That was the money that flowed through the Women's Fund? Okay, I know what it is. Okay, let me ask you this, so, I'm just curious, is the new West office move for WIC, is that close to the election commissioner's office?
It's 120th and I.
120th and I, okay, that's not it. That's, so is that in the plaza where One World used to be?
I don't know if
Out
One World
across
used to
from,
be there. It's,
the FBI office?
yes. Did One World used to be over there?
Yeah, they used to.
Okay.
They still got it over there? Okay.
Yeah, there was a credit union or something on the corner and we took the bank spot, so.
Okay, okay. I think, oh, your first slide, I'm just curious, when it said, let me see, second slide. So the COVID vaccination rates, the race numbers, are those percentages broken down by people who got the vaccine, or is that compared to the overall population, like we used to do it on the dashboard?
Repeat the
Meaning,
question?
is that breakdown just the percentage of the people who have gotten the vaccine?
Yes.
Okay,
So that is individuals that have received the COVID vaccine from us in 2022, what their race ethnicity breakdown was.
okay, okay. All right. Okay. Any more questions? Seeing none. Thank you.
Yeah. Thank
Appreciate it.
you.
So now we'll flow right into B, which is the community health worker presentation.
I will make sure that the slides get shared. I apologize, online folks.
No problem.
Good morning. I'm Patty Falcone. I'm the Supervisor of Health Promotion, and I'm just here to update about the community health workers. We were here back in December. All the community health workers were able to join me then. So the first thing, just kind of an overview of all of the different things that the community health workers are working on is navigation, our diabetes prevention program, working through trying to find resources throughout the community, additional funding, the community needs assessment, alternative mental health program. We are partnering
Patty,
with.
what's showing up there is not showing up online.
What's going on?
I don't know. This one.
Yeah, there it is.
We are partnering with community agencies, and then also they attend community events. All right, so some of the challenges that we've had is waiting for funding for our mental health programming. We did finally receive the funding. We were denied some other additional funding, but we're always going to continue to look for that funding for all of the different programs for community health workers. And then we've also had an increase in Haitian refugees, and we are partnering with One World to find resources for the population that's coming into our Douglas County. And this is one of the places that we are finding individuals for navigation. So accomplishments this year is we found funding for the new Lens. It's an alternative mental health program. This program is geared toward youth, ages 14 to 17. And really, the focus is instead of looking at having individuals sit in a chair and talk to the therapist, it's looking at multiple different ways, new ideas. And some of them are ecotherapy, art therapy, equine therapy, and the goals of the program is really to reduce negative stigma of mental health, introduce new ways to improve mental health, and then really just to increase the awareness of the importance of mental health support. So this program is a 6-week program that will start in June and run for 6 weeks, and then we are getting youth. One group will be girls, and then another group will be boys. Okay, and then we do have 2 community health workers that were trained in the diabetes prevention program. From that, we have one that will be starting the end of this month, or like I guess next week, and it will be in Burmese, and then the other one individual was trained in Spanish. And then we're revising the community needs assessment. We did have a community needs assessment that we put together. It was only used one time, and then we were able to work with a Creighton student who was able to really look at the questions and to really shore up the survey and to make sure that it's all kind of, the questions are better, and then we're able to make sure that he was also able to work with us to create graphs and then also to look at how to map the survey questions as well. And then again, we're partnering with many community agencies like One World. We're also partnering with them for navigation on other community health workers, not just for the Haitian refugees as well. Some of the goals for this year ahead, we'll be continuing with our navigation. Navigation, we have individuals who are located out in the community. They have people who are walking in, so those are individuals that we can kind of slide right into navigation. And then also just outreach to other agencies. They're referring to us as well. I mentioned the diabetes prevention program, the New Lens program, that is the mental health program for youth that starts in June. And then working with a Douglas County Health Department's clinic on client referrals. We'll be starting that up here within the next couple months. And then also we, as part of one of our work plans for the community health workers, the focus is going to be on digital innovation. And this is really looking at, as you know, during the pandemic, people weren't able to meet face-to-face. So people were having to use their computers, their phones a lot more than just to be able to do things. And a lot of times people get a phone and they don't know how to use it. So part of this training would be in regards to teaching people how to like put apps on the phone, take apps off the phone, filling out forms. That was a big thing. Taking a photo of their form and sending it, that has been a big, I guess, a negative piece that people are not able to do when we're trying to fill out forms with them. So if they're not able to come in person, it's like trying to teach them on the phone. So it's going to be better in person to show them how to do that. Filling out job applications, as well as in safety online, really looking at phishing for emails, what to look for, and then assisting their children with homework are some of the other topics that will be included in that. And then we also have one individual who will be working with the colorectal screening program that will be starting up here. Okay, do you have questions?
Dr. Jones, I know you got your question.
Always. For the diabetes prevention program, can you talk a little bit about these classes that will be offered? And is it going to be like the typical 16-week or whatever it is with the lifestyle coach and that kind of format? And then also, how do you make referrals for that?
So currently the one class that we are starting is with the Burmese population, and she is working through Heart Ministries, sorry. And that's where she's getting her population, her clientele right now. And I think she has like 20 people signed up for the program currently. And hopefully they'll be able to stay with us. It is a year-long program. The first 16 weeks are each week, and then it will go down to bi-monthly, or monthly, then bi-monthly, and then it's like a 24, 26-week program.
Also, do you have like a handout or information on the New Lens program and how to make referrals for that. And then has there been some thought about like individuals with different gender identities? Like where are you going to put them?
So so currently we are working with 2 different agencies that we're going to be getting our referrals from, and they will be helping us choose who would be a good candidate for that. That's Girls Inc. and North Star. And then I think this is kind of a pilot just to work on, just to get it started. And then we would love to be able to follow through with this next year. I know that that was a question at the very beginning of this, so anyone is able to join as long as they attend one of those 2 places currently.
Thank you for the update. On there, you had mentioned you're revising your community health needs assessment. And I just want to clarify, is that the reoccurring, is it a specific one that your community health workers do?
Yeah.
Okay.
Just trying to find out, I think one of our community health workers was really just trying to find out what some of the needs were in her community. And we're hoping that after being able to update the survey and kind of bring it shored up, that we'll be able to utilize it in other populations as well.
Okay. Got it. Thank you.
Okay, Pat, let me ask you, in your first statement, I'm just curious in how you framed it, or did you mean you just received it? So you said, I think it was the second grant, that a couple of grants were denied.
Correct.
Do you mean that you just didn't receive them, or somebody like denied them?
They denied them.
What was the rationale?
I'm gonna have to defer to Leon.
Need you at the mic. Bill.
So one was with a behavioral health, and I think just some of the details that they were needing, and it maybe didn't quite fit with what they were wanting for the goals of that grant application. That was Beacon. The other one.
It's the $10,000.
Oh, and did you get feedback on that one? I don't think we did another small one, and we didn't receive it, but we did not get feedback yet on that one.
Okay. I'm just curious, this is the first time I heard about Haitian refugees really officially on the record, so are you seeing an increased Haitian refugee population in South Omaha? I mean, or to what degree, or is it just, this is the first time I've seen Haitian refugees show up?
It's just it's a new population that's coming into Douglas County.
Really?
And I know that our community health worker encounters them when they do come into their Heartland Integration Center. And then also One World reached out to us to connect to see if we would be able to assist with that.
Okay.
And our community health worker does speak Haitian Creole.
And that's only showing up in South right now?
I'm not sure the exact location or geographical area, but they are attending One World, yes.
Okay. Yep. Let me ask you one more before we go to chat. So the digital training deal, so help me connect, because you were saying stuff is like homework there. So is all of that being tied to the new EPI?
Tied to the what?
The new epidemiologist. I can't recall his name now. The one in Jamin's area. You're thinking of Akshay? Yes. Sorry. I need to just write his name somewhere so I remember.
Not yet.
Okay.
But certainly that's something.
I'm just curious, how long does that take? Because there's a story somewhere to be told with that, and I'm just wondering, because it just perked my ear up when you said they're doing digital stuff, helping people with homework, and then something else, job searches, stuff like that. I'm just curious how long it's going to take that to tie, because that helpline that was started during COVID is still operating.
Correct, but
Does that come up through you, or it comes up through you?
The helpline?
That helpline, yeah, that comes through you?
That actually, the supervisor of STI is still over that, so I let.
Okay.
Yeah, so our info line is still in place. And I didn't get numbers for that. I should have put it on there.
No, it was unexpected, but the thing that you're saying digitally, I'm just making sure because at some point, at least that's how I picture say his name one more time, Dr. Hughes.
Akshay.
Akshay. I'm picturing Akshay soaking all that up somewhere and being able to tell a story through that. So if you're not, I'm just putting it on the record. So that's what I'm envisioning when he's here. Okay. Alrighty. Let me take you through the chat. Question: Are we planning to partner with Metro Community College Express? They also offer some digital innovation training.
At this point, we have not, but we could reach out to them as well. I think this is just, I've asked the community health workers to come up with a work plan to what they would like to work on. And this was one that they found that their community really needed. And I know during the pandemic, I'd seen articles where they were actually handing out phones to the elderly population, and then they had training on how to utilize that so they could have their doctor appointments online or like by phone.
Okay.
And so it's been kind of a need that's really been brought up. So I thought it was a great program. But yeah, we could reach out to Metro, no problem.
I'm gonna kind of summarize this question because I think this is where it's going. So basically, originally we talked about all the community health workers out there. Are we taking the initiative to kind of be an organizing, gathering, partnering body to kind of get an idea where everybody is with their community health workers and what's out there? Okay, here we go. You might as well just sit right there.
I know. Getting my steps in today. Yep. So I have reached out to some folks within Omaha to kind of get a good list. To be honest, I just haven't had time to sit down and like get that organized, but it is on my radar to kind of pull together all the bigger organizations that have community health workers or are doing the training, just to kind of see what the needs of our community are, what are we missing, what are you guys focusing on, that sort of piece. So it's on my radar, I just haven't gotten quite to it yet.
Okay, so stay there. From the infrastructure grant then, I know there was a little bit of concern about capacity. So are you going to get this community health worker organizer, or I forgot the position you talked about. Is that coming through the infrastructure grant?
The community health, it would be a community health educator too, and they would be responsible for kind of coordinating. Yes,
That's
that
coming.
is in the infrastructure grant.
Okay.
Yes.
Got it. Last question then. Can the board see the assessment, the community health worker assessment survey is interested in just in what questions they're being asked? The community's being asked.
Yeah, we can share that with you.
All right. That might be a committee agenda item just to go into detail with. Okay. That's all the questions I see.
Sorry, back to
Jones,
the question
new
about the referral. So it sounded like from the clinic, you're able to make referrals for community health workers.
We will start the clinic within the next, we have not started that process yet.
Oh, my understanding was like currently from clinic at Douglas County, the referrals are being made for
We'll
the
be,
community
we'll be
health.
starting that in the next couple months.
Gotcha.
The 699, that's just from their outreach, getting folks in and referring in. So that could be through the info line, that could be coming into St. Martin de Port or through
Harlan Integration Center.
Yes, so coming in through the different areas where they're housed in the community, just coming in and someone saying, hey, or from their outreach efforts that if they've been at big events saying, hey, here's our information, call us if you need anything. That's solely been kind of word of mouth, of not any formal referral process at this point, but working on getting kind of their name out there, what work they're doing, and really just spreading the word by voice.
So is there an opportunity for people in the community to make a referral, or how would they go about doing that?
Yeah, if they would call the our info line, that we do receive referrals that way.
444-3400.
You want to repeat it on the, so it picks up?
444-3400.
Got it. 402 area code. Alrighty.
9
Yeah.
to 3, Monday through Friday.
Got it. Questions? Any more? All right. Patty, thank you. Okay. Let's go now to the department reports. Any board members have questions from the reports? Okay, seeing none.
I just
Go
want to
ahead.
say thank you for the divisions for transitioning to the new templates. So very helpful. Thank you.
Seeing no questions on the reports, though, Dr. Hughes, I'd like to, let me put a topic on for the next administrative meeting, happens in May. The air quality, because I just need to get a grip on it. There's been some exchanges. It looks like it's gonna handle itself, but I'm just curious. I know there's certain standards we have EPA-wise, but there's a lot of just exchange about the OPPD piece. That seems to kind of worked its way out, but I just want to get a better grip on that question.
I will add that to the agenda, and I will invite our supervisor over air quality to attend so he can answer more in-depth questions for you.
Okay. And I guess you might as well too, just add Patty to the survey question piece just to see what's on there to talk about it, to knock that out. Anybody else? Any other questions, concerns, all minds? Councilman Festus?
I appreciate Commissioner Rogers raising the air quality question, and I do want to invite the Douglas County Board of Health to participate in the city's climate action plan that's getting underway. That'll be occurring shortly, and have broad public engagement this summer as we create a plan for the entire community, and it'd be great to have your involvement. And then secondly, I also appreciate Commissioner Rogers raising the issue of LB 77 a little bit earlier in our meeting, which is the concealed carry legislation being considered on final reading today in the legislature. I was a little slow on the take, but I wanted to just chime in that that is of concern to our community and to the city, both from a public safety perspective and a violence prevention perspective. And that's why the mayor and the police chief and the majority of the city council is opposed to that legislation. But should it pass today, I want folks to know that the city will be required to repeal about 10 different sections of code pertaining to guns and weapons. And so that's of concern to us, and I would think of concern to this board and those interested in public health and violence prevention. So I want to have that on your radar screen too.
Well noted. Well noted. Any other board comments for anyone? Okay. With that, there is no need for executive session. Is there a motion to adjourn?
Motion to adjourn.
Motion by Festerson, is there a second?
Second?
Second by Weiss. Roll call.
Yes.
Yes.
Yes.